welcome back to our case-based learning with experts series. I'm Ian from MDSA's Academic and Research Committee. In today's episode, we'll be talking about autotransplantation with Dr. Sing Ying. Doctor, could you please briefly introduce yourself?
My name is Lim Sing Ying, and I'm a pediatric dentist. And also, I graduated since 2013. And then after that, I worked in hospital base for quite some time until 2019. Only I pursued my postgrad in UK. And then I worked with KMM for more than 10 years, and then I quit, and then I'm in private for full time.
Doctor, I learned about one of your cases, which is the autotransplantation. Could you share more about the patient's case history?
This is a 14-year-old girl who actually came to hospital, and then she actually presented with a missing tooth, clinically missing one tooth, and then it was actually impacted, and then this one was actually kind of impacted and horizontally placed as well. So we actually see the kids in combined clinic in hospital where you have ortho and also surgery, which is PEs, and also prosto together.
Doctor, what were the indications in this case that made you choose autotransplantation instead of bone gold chain or implants?
So usually when we are talking about autotransplants, it's always considered almost like a last resort, meaning we will try to save the tooth by using gold chain traction first, because you can make sure that the vitality of the tooth can be preserved. So it's never autotransplant at the first choice. Okay, so one thing that why we actually choose autotransplant is because our orthodontic trim, the orthodontist said that there's no way to actually track it down, because when it tracked down, the positions is actually overlapping on the 1-2. So if it track down that time, the 1-2 roots will actually resolve. So you are kind of like a wasting of another tooth, especially this case is a class 3 case. So it means that we want to preserve all the upper teeth as much as possible so that it wouldn't be a severe class 3 later. So in these kind of cases, we actually talk about it, and we told the orthodontist that since it's either removal or we can do autotransplant. If we remove, it means that the kids actually need to go for an implant later. And you see, implant cannot be done at this age. It has to be after 20 plus, or even the earliest also 80. But usually we suggest to be 20 plus, right? So in these kind of cases, we said, why not give us a chance that try to save this tooth? If this tooth jadi, then jadi lah. If it's not, then at least this tooth can actually hold it for some time, all the way until the kids actually need the implant. But at least we preserve all the bone around it, so you don't have like a collapsed area.